In this video, we're going to be targeting the two most common foot problem that I see here. So the first one is great toe extension. So to test this yourself, you're going to grab the mid part of your foot and try to use the other hand to extend the toe. So this should be very easy when you're adding the pressure. So really grab here. So this should be easy. You shouldn't feel any pain where you're grabbing under your foot. You shouldn't feel any excessive tightness or tension underneath your toe. And just to compare, try your other side, which there's always one side for most people that's better than the other, and just compare what it feels like from one side to the other. If both feel the same or they both feel pretty restricted, then what you're going to do is you're going to do this video all over again after and repeat it on the other side. So what we want to do to kind of get the tissues moving under the foot to loosen that, we're going to put our fingers between our toes here. It's pretty painful if you're not used to it, so just do what you can. If you can fit all 4 fingers, good. If you can't, then just do what you can, 2 or 3. And we're going to exaggerate these circular motions. So with the hand that is holding the heel, I'm trying to keep the heel as stable as possible as I'm really torquing the foot and the ankle in circular motions here. Now I'm also going to do point and flexion motions. And of course, if this is too fast of a pace for you, slow it down. That's the best part about doing this at home. You can do it at your own pace. Now, really almost like twist your foot like a cloth. When your heel goes one way, your toes are going the other, and just keep repeating, twisting it back and forth, back and forth. Now let's test our work to see how that is. Stand up and compare the foot that you just worked on for mobility compared to the other foot. You should notice a bit of a difference. Your foot will almost feel lighter or more flexible. So now you should notice that its ability to extend is easier. But let's get a little bit specific into the big toe now. And you're going to grab your big toe, and as best as you can, you're going to make circular motions. So I'm stabilizing the base of my big toe with my other hand as I'm gently performing circular motions. And now let's go the other way. Keep in mind, this is a motion for the toe that most people do not do. So it's work that you'll have to build up to. And now let's do the forward and backward motion of the toe. So pointing and flexing your toe essentially. And again, just work the range as best you can. You should not feel at any point in time sharp shooting pain. You might feel a little bit of a stretching type of sensation. That is normal. Now with your sock, you're going to weave in and out your toes. So this is going to help keep your toes spread to give them a different range of motion instead of be so compressed inside the shoes. So when we do this type of range of motion, we're starting to open up the other muscles in the foot as well. So now go up on one foot onto your toes, and you're going to just swivel back and forth from your big toe to your baby toe, trying to work the ankle as you're working the toes in different ranges of motion in extension. So this is what it looks like from another angle. Keep in mind, I was a dancer, so my flexibility may be a little bit more, but just do what you can with your own body. Now flex and rise up under the ball of your forefoot. And scrunch your toes and up into the ball of your forefoot and roll up onto your toes. So essentially ball, flexing the foot up under the ball, and scrunch the toes. Ball, flex, up onto the toes, and repeat. So essentially what we're doing is we're just working and trying to push the limits of the ligaments, the tendons, the other tissues, even the fascia of the foot. You can even place a ball underneath the middle part of the forefoot, and now scrunch the toes and extend them, scrunch them and extend them, and scrunch and extend. So this can be great work if you have tight feet if you feel that you're starting to develop plantar fasciitis, if you just want to work your foot so that you don't lose its mobility, these are great exercises to do. Especially if you have osteoarthritis of the foot or the toes, you want to maintain mobility as much as possible. And now let's work on the strengthening aspect. Keep in mind, just because a muscle is tight does not mean it is strong. That is a common misconception here. So when you go up onto a ledge, you don't even have to have it this high. It can just be a textbook or a thick book or on the edge of your steps at home. And again, if this is too much of a fast pace for you, you can simply go at your own pace or only do every second rep of what I'm doing. Make it your own, rest as needed, have water close nearby. And now we're going to work a little bit on eccentrics. We're using both feet to do the heel rise, up on one and lower. Eccentric works, meaning the muscle is contracting as we're lengthening the muscle. This is very great work for the tendons, and it's a great exercise for the muscle as well to really work on strength and just to help overall tissue elasticity. Eccentric work is very important to include in every program that you do, especially if you're rehabilitating from any sort of lower body injury. Eccentric work helps to prevent injuries in the future. Now the last bit of work to stretch underneath the foot here, we're going to assume this position. So our toes are scrunched right underneath us. Keep in mind this is extreme, so if you need to lean forward to take some pressure off, you can. Otherwise, you can just switch back and forth as I'm doing here. This is probably a level 3 versus level 1, which would be more that position. So you do not have to follow along with what I'm doing. You can either just maintain one or the other. And I would even recommend at the beginning to just maintain a single position, because again, this can be intense for beginners, especially if your toes aren't used to it. So now add in a little bit of a scrunch and let your toes rest. So try to scrunch your toes underneath you and rest. You can do this at the same time you're leaning forward as well. And now when you come out of this position, just recover very slowly. And it's normal, just so you know, to feel very stiff or sore, and that will pass momentarily. The last exercise that we're going to be focusing on is the dorsiflexion ability of the ankle. So that's your ability to bring your toes up to your nose essentially. And we're going to be working on the posterior glide of a bone in the ankle called the talus. So it's important when you put an elastic band that you have the elastic band below the ankle bones. You do not want it above the ankle bones. You want it right below the bones because that is where that talus bone is located. So really make sure those bumps on the sides of the ankles, the elastic is below. This is probably the range of motion in most people that is limited. That's what I see. And for me, from my bony structure, I have very limited range of motion. I would say honestly below average, and it's just the way I am. I work on this a lot and I have minimal improvements. So for me, that means there is a bony structure just the way I am. So you can do all sorts of different variations. I'm showing you a couple here. You can have both your hands on the ground as you're moving. You can even come up and lean and put your weight on the top of your knee to put a little bit more pressure on that ankle so you really work that talus. So what's happening is the elastic band is pulling that talus back as we are moving our knee forward, trying to get a bigger range of motion of the ankle. I'll show you a different variation as well if your knees are are experiencing too much pain when you're in that position. So you can just simply take this stance. You can even use a chair or a table or a wall to help you balance as you perform this motion. Again, make sure you're checking yourself that the elastic band is below those 2 ankle bumps on the sides of your leg. And work through it. Ideally, your heel will not be popping off the floor. And now we can finish off with doing some dorsiflexion. So if you feel like you need more attention on the band, what you do is just take a couple steps forward and you can work on this motion, bringing the toes to the nose. That's another variation as well. Remember to breathe. Take breaks as needed. All right. So that is the end of the video today. We worked on 2 things, increasing the great toe mobility as well as increasing what's called ankle dorsiflexion. So these are the 2 motions of the foot and the ankle that are commonly in dysfunction. So getting these 2 motions back can help greatly with knee pain, hip pain, and even lower back pain. If you have any questions for me, leave that in the comments below. And if you have any requests of videos you want to see me make in the future, leave that in the comments below as well. And don't forget to subscribe and hit the little notification bell, because if I make one of your videos, you'll be one of the first to be notified. Thanks for all your support.